Thank you very much, David, and thanks to all of you for this remarkable privilege to be here and to try to touch on some of the highlights of an extraordinary day of comments. Actually, just to pick up on the last point, I'm not sure that I can characterize the relative value of population health science endeavors in comparison to others, but I have no doubt, absolutely no doubt, that the marginal utility of every dollar invested in population health science research far exceeds the marginal utility of investments in other arenas, given the tremendous complexity of the field and the importance of engaging that complexity head on. My job is to touch on a few of the highlights that I've heard, of course, over the course of the day, and I'm going to say three things, basically, and they all relate to the day's inspiration. The inspiration of the meeting, the inspiration of the occasion, and the inspiration of our colleagues, all of you here and your colleagues throughout the nation. The meeting has been inspiring for its content, for its insights, for its participants. I know I felt that way, and I think that many people in this room felt the same way throughout every minute of the day. In the content, it wasn't only the theme and the title of the meeting focusing on connecting and bridging, but the topics and presentations brought out those dimensions very clearly and in a most compelling fashion. And the participants who were bringing out those points in that compelling fashion represent the multiple disciplines that make up, in their blended manner, the field of population health science. Someone mentioned at the early in the day that population health is not about the social determinants of health. It is, of course, about, it underscores the importance of the social determinants of health, but we saw today, we heard today, we experienced today disciplines that range from sociology and psychology, epidemiology, molecular biology, engineering, city planning, medicine, the list goes on, and that is the beauty and the necessity of population health science. The insights that we've heard were just too many to identify even a small representative sample of the comments that have been made throughout the course of the day, but I'll just touch on a few that I thought were especially important for us all to bear in mind as we move forward with the challenge of growing the field. We heard at the very beginning of the day from Mark Hayward about the importance of looking beyond approximate risk factors. I think, actually, if you'll remember, that was the point at which he said there are dinosaurs roaming the landscape, and some of them have been here for as many as 15 years, and I got a little worried when he made that reference. But he did underscore the fact that we needed to look beyond those proximate risk factors and the importance not only of health in all policies, but in health at all ages. From Laura Gottlieb, we heard about the promise of engaging clinicians as change agents for action outside the clinic doors. And that was an issue that was reinforced by Bill in his comments just a few minutes ago. We are in a time in which the enterprise, and it is an enterprise, of medical care is moving outside the doors on many dimensions. And fortunately, one of those dimensions that's becoming increasingly clear, whether you're looking at it from the perspective of a behavioral economist or whether you're looking at it from the perspective of a social worker, that we need population health science to show the way to ensure that we're effectively reaching outside the clinic doors if we're starting the challenge from a medical care perspective. From Jeff Livy, we heard about how policy is a data-free zone. That's what he opened up with. But he also said, implicitly or maybe explicitly, that it's data-free in part because so much of the data producers are working in isolation. And that's why this group and this society, if you will, what you folks are doing by bridging and connecting, not working in isolation, is so fundamentally vital to ensure that when policy moves forward, it is not in a data-free environment. This afternoon from Alonzo, we heard that the Robert Wood Johnson Foundation is committing 2 decades and billions of dollars to strategy that grow the collective impact of insights and strategies to build well-being. Now, population health is the driver of those collective insights and strategies. So there is a strong call from a foundation that not only is a sponsor of this meeting, but obviously an important player in advancing population health science to the field to ensure that the scientific capacity is available to help guide the foundation's efforts. From Ana Diaz-Rue, we just heard a reminder of the challenge of understanding complex mediation in which different people get some diseases through very different paths. And we're only going to understand that through the work of you in this room. And from Bill Kassler, we were reminded that CMS is becoming committed not just to health care, but to behavioral, social, environmental determinants of health. In other words, they're taking seriously the point that Jeff mentioned at the outset of his comments, that the ACA is in many ways, and certainly in my view, the most important population health bill that Congress has ever passed. The very important dimension of that bill is that several of the elements cannot be engaged on behalf of population health without the leadership of the folks in this room and your colleagues beyond. It is a bill that is constructed with a number of very elastic clauses that give us the power to take advantage of what's in the bill, to change population health and population health science, but it's going to take a very determined effort to have it reach its full potential. All these are very encouraging perspectives, but more importantly, they really are a mandate to up the ante in population health science, which brings me to the second inspiration, and that's the inspiration of the occasion. The occasion being the public launch of the Interdisciplinary Association for Population Health Science. This is long in coming. In many ways, the Robert Wood Johnson Foundation launched the Health and Society Scholars, as Pamela Russo will remember, looking to the creation of this kind of scientific endeavor that could rally participation from like-minded individuals around the nation and grow the participation of others. David reminded us that it was before then, 1974, when Victor Fuchs implicitly called for the growth of a field of population health science, although he wasn't using those terms. Jim Marks, last evening, took us even further back, 160 years ago, to John Snow, and his drawing upon the tools and illustrating the potential of those tools to change the health of an entire population. You could even go back 2 millennia to Hippocrates with soil, air, and water to find implicit and in some cases explicit calls for stronger attention to the way in which these factors played out in shaping the health of the populations. The importance of understanding various domains and how they affect our health has been around for a while. But even more important is understanding the way these domains intersect, the complex ways in which these domains intersect to change our fates, and that is what the challenge that you've taken on. So this is a very important and propitious moment for the development of the field of population health science, with the creation of the Interdisciplinary Association for Population Health Science, which can help sort out and communicate some of the definitional issues, can help sort out and communicate the relationship to some fields like precision medicine, or the way in which precision medicine can help advance population health science and the reverse as well. With your help, this field can grow and reach the potential that it has and that it's for which it's expected to contribute. And I need to remind all of you who haven't signed up yet, there are sign-up sheets outside the door, and please do that before you leave so that we can ensure that there's an ongoing communication with each of you. And be sure as well to mark on your calendars the meeting at Penn State a year from now and the meeting in Texas 2 years from now. That brings me to the third inspiration I want to underscore as we leave today, and it's our colleagues. The colleagues in the community at large and here with us today are really truly inspiring in every way. Collectively, the energy, intelligence, creativity is palpable. I think Bruce Link made reference to that at the very opening of the meeting. And individually, you are all of that, plus you're pretty nice people. This is a good group to be associated with. And to remind ourselves of those with whom we're locking arms, that is everybody in this room, I can't help but take the opportunity on this day in particular to call out a few groups to remind ourselves who brought us here today. The organizers, the sponsors, the co-hosts, the board, the advisory council. And I want to mention them individually. I can't mention everybody in this room, although I'd love to. But clearly, the work that Jennifer Dowd and Carlos Mendez de Leon and Meredith Barrett and Doug Judy, Michelle Frisco, and Dorothy Daly did as the planning committee for this meeting was great. I have a few more lists to go through. The sponsoring organization, very important, and we have Alonzo and we've heard, and Pamela Russo here, and we heard from Jim Marks, and I'm going to forget somebody, forgive me, but the Robert Wood Johnson Foundation has been terrific in providing the Not just the funds. I mean, the funds matter, but the leadership and commitment to helping ensure that this international capacity grows in the way that it can. And our co-hosts are also important pioneers. You saw the logos on the slide earlier with Kansas University and Penn State and the association, the IAPHS, as well as the foundation, and I have to underscore, out of pride, my IOM colleagues from the IOM Roundtable on Population Health Improvement, which is co-chaired, as you heard, by David Kindig and George Isham, and Alina Baku. Alina's probably here somewhere, and Colin Fink, who were terrific in helping to ensure that things have gone smoothly. To the board, and listen carefully to the board members who have volunteered to take on the challenge, but it's an exciting challenge of helping to provide the construct that can be used to advance the growth of this field. Dorothy Daly's the president, Yonette Thomas the vice president, Jose Pagan the treasurer, Gerard Lebeda the secretary, Michelle Frisco has been an at-large. She's rotating off. Mark Hayward has just joined. And I have to mention, last but first, in many ways, Chris Bachrach, who has stepped up as the managing director of the board. I also want to acknowledge and thank my colleagues on the Advisory Council, Anna Diaz-Rue, Jonathan Fielding, Sandro Galea, James Jackson, Bruce McHugh, and Alonzo Plow. We are thrilled at the opportunity to work with this committed board and with all of you in the effort to move the organization forward. And finally, I obviously want to thank all of the presenters who did such a wonderful job, not only in the presentations, which were fabulous. It gave me a great thrill to hear how many of them mentioned along the way that they were from cohort this or cohort that of the Health and Society Scholars Program, because what's really impressive in that respect is how quickly the Foundation's legacy have moved already into positions of leadership in helping to move the field forward. So the presenters have been but a small glimpse of the remarkable talent in the field, and we're grateful for their contribution, and obviously to each and every one of you for what you do every day to help move this field forward. In the collective spirit of the meeting and the field, let's close with a round of applause, not alone to those who brought us here, but to each one on your left and on your right who are going to lead us forward.